Bukis Pak kita.
We have visited few of the areas, as you also have seen since you were following the convoy. Thank you for covering the whole visit. Now, as we reviewed the case with the government on number of occasions last year, this year similarly we had one review which was chaired by the Honorable Speaker, wherein the members present there, which represented the opposition as well, including myself, have looked at all the necessary measures required to be put in place specific to deal with this second wave of the pandemic. We did look at areas which needed to be attended by the government, particularly in respect of ramping up the facilities across different districts, and also the various other collateral measures which are required to be put in place. Now, the government's response to our observation has been that there has been a response though, but then very sluggish. Today we have visited the dedicated hospital in Joai, where the measures to ensure that we have enough oxygenated beds are in progress. We also visited the designated corona care center, which is yet to be operational. In fact, it has been just met ready. And another one, rather two of the corona care centers being managed by the community themselves. And one of them is only ready. It's not yet operationalized. So to be practical, we saw only one which is operational, where we have a few cases there. So our observation based on these and earlier inputs that we have received is that the government need to provide the necessary support to the health department. When we look at the support that has been provided are completely inadequate, and even whatever is being provided is in the process of implementation, which gives us reason to believe that the overall preparedness was completely missing, and unfortunately that has resulted in painful experience for all of us, wherein we have lost precious lives. So measures that could have prevented the number of incidents and measures that could have saved precious lives. So those two things are seen to be wanting. Now, here in Joy, the dedicated COVID hospital, where all the measures for providing oxygenated beds are in progress, you have yourself been there as a witness. So piping is on. We only hope that it will be completed sooner than later, so that at least the burden of referring the patients to Shillong can be avoided. I had all the inputs based on our conversation with people from different districts. Now, particularly this Jaintia Hills region, most of the patients were compelled to be shifted to Shillong. And this is precisely because of the inadequate facilities in Joy itself, which in turn add extra burden on the availability of beds for the COVID patients in Shillong. Most of the private hospitals in Shillong are flooded by patients from other parts of the state, from Rivoy and from Jaintia Hills. This is because the facilities which could have been created here on time were not done. Therefore, the government has to provide the necessary support to the health department, the necessary support in time, not just the support, but in time. And even as we talk today, since we really don't know how the virus is going to behave, we have to keep in mind that after the second wave, we need to be prepared for the third wave. Last year, when we interacted with all of you, I have said that based on what we know of the past pandemic of this nature, particularly when it is a pandemic associated with virus, then you will always see waves after waves coming. And the kind of pandemic that has happened in the past give us enough inputs. We have the access to all the well-documented informations available about the past pandemic. So from there only, we have to apprehend that pandemic of this nature will keep on confronting us with waves after waves, surge of cases. And this is exactly what we have seen. Therefore, keeping in mind the likelihood of the virus to mutate and further create surprises, we need to be prepared. Therefore, it will be in the fitness of things that all the line departments who need to come together and fight this war against the virus must be provided all the necessary support. We must have enough exhaustive auditing done in respect of our capabilities to fight against the virus. Because when we are at war, we need to know how prepared we are. Are the arsenal enough? Keeping in mind the enemy's arsenal, the wherewithal that we need to have. So we need to continue in our effort to see that all the necessary support is provided to all the line departments, particularly the health department. Today, one important thing which I want to share with you is that while we have the oxygenated beds, and when we need to look at transferring the patients because of the severity, who will require ventilator, you will also have to have manpower. Now, this manpower auditing has not been done properly. That's why we don't have whatever ventilators are available not being put to use. This is precisely what is happening in other districts. Talk about Garo Hills, talk about Jaintia Hills. We should have enough manpower. We have to send our doctors for training, particularly in view of the fact that we don't have enough anesthetists. We need anesthetists to operate the ventilators, to take care of the patients who are compelled to be supported by the ventilators. And we all know about our strength. How many anesthetists do we have? Even for normal operations. And knowing fully well all these deficiencies, all these weaknesses, it is very important for us, since we know that we are going to fight against the enemy, if we need to ramp up our capability, our arsenal. That is how you ramp up your arsenal, your capability. And I'm sad to see that this has not been done, but I have had an interaction In fact, even before this, I have been talking to the director, DHS, the other senior officers. Look at the alarming number of death count on a daily basis, and look at the percentage of the death. If you're looking at the death count, it's more than 2%. Anything beyond 1% is a matter of concern. And if you look at the cause of this high death count, then we are able to also know many things which revolves around the deficiencies. And these deficiencies must be taken care of to avoid loss of precious lives. Dealing with these serious COVID patients, as per the progression of the disease, when the patients require to be shifted to ICU, if the patient required to be shifted from one district to another, the precious time which is wasted in the shifting of the patient and the challenges of getting back after getting referred or after being shifted, that is where precious time is wasted. And subsequently, besides the burden or the pressure on the hospitals in the state capital, you end up adding more severe cases to those hospitals. So every facility is required to be created for the Jaintia Hills region in Joy, for Garo Hills region in Tura, and we cannot have any other option but to do it. And we'll be taking it up further after this. I wish all my beloved families whose patients are in different COVID care centers, community COVID care centers, institutional COVID care centers, and are some of them who are in hospitals. I wish all of them a speedy and complete recovery. And also, we convey our deepest condolences to all the family members who have lost their loved ones during our fight against this pandemic. We'll continue to see how we can draw the attention of the government and do good to all these deficiencies. Thank you.
Sir, I've got a question, sir. Sir, the government is planning to set up 2 hospitals in the state. One is Tura and one in Shillong. Don't you think that this is a wastage of the money instead of circulating that money to the 11 districts so that the latest technology and facilities will come in the districts wise?
See, no measure in isolation is enough. In addition to any new infrastructure proposed to be created, what is required is to look at what are the existing infrastructure available. Okay. And ramp up the facilities in this existing infrastructure. Today, we have seen here in Joy itself. We have come here because we wanted to see in the ground zero. Now, this facility is capable of taking care of quite a substantial number of patients. The problem is that the facilities which should have been provided here and the need to ramp up these infrastructural facilities were not done on time. Now, existing infrastructure, say for example, we talked to our friends in Rivoy. We wanted the maternity and child hospital building, which is completed in, what is the name of that place? In Rivoy. Just after Umsning. No, before Umsning. I myself laid the foundation stone for that building. Umra. Now, these are existing facilities. I am giving you an example. Okay. The one which we have visited today, these are existing facilities. We have many other facilities which can be optimally utilized if fully equipped. Now, in addition to that, as I have said, equip the infrastructure. Also, see how you can have the ready manpower, because they will be there as the frontline warriors. That is also missing. As I have shared before you. If you create more ICU beds, if the patients, based on the progression of the case, require more patients require to be put under ventilator, you will require adequate manpower who are trained. We don't have, as of now, we don't have. So we need to understand all these deficiencies and prepare. We cannot shut the stable door after the horses bolted, because our job is specific and we must be focused, saving the precious lives while fighting against the pandemic. The second wave was inevitable, and so also we should presume and assume, God forbid, but we have to be apprehensive of third wave. How fast it comes or how late it comes is a different thing. It's not something which anybody can predict. But please remember one thing. As the virus is allowed to get more and more new hosts, in other words, if virus is allowed to continue with the transmission chain, the virus will mutate faster. Okay, that's how the virus behaves, because of the diverse immune system of individuals. Therefore, the fight against this pandemic, therefore, is not going to be enough if we look at measures in isolation. Measures has to be comprehensive, and that's how we have to proceed. Vaccination is the weapon. Now, if you are fighting against the enemy, and if these weapons are not there, that means you are fighting the enemy without weapons. It's as simple as that. Therefore, if you are fighting against the enemy, and if you are serious that you should fight effectively to win the war, then you must have the weapons and you must give the weapons. Because this war is not being fought by one individual. This war is to be fought collectively, and only when we collectively fight, then only we will win. See, if you are looking at all these deficiencies, as you have said, ramping up our health infrastructure and thereby equipping these health infrastructures which are created with all the wherewithal, which includes the manpower. Now you see, there are plenty of young boys and girls. We are proud of our children. Today, how many of our young children are determined or have this ambition of becoming doctors? It's something which gives us reason to be proud of. But at the same time, it is very painful when these young men and women who wants to become doctor and who are eligible to be a doctor, who are eligible to be medical students, don't end up getting medical seats. The medical seats are limited, you see. That was the reason why we came up with medical colleges. Now, what is the status of these medical colleges? If people talk, see, action speaks louder than words. Yes, indeed, during our time, we decided to create all these infrastructures. But at the same time, simultaneously, we have to look at fulfilling the aspiration of our young men and women. If you have so many young men and women who are willing to become doctor, it's so difficult to convince children, okay, Baba, try to become an engineer, Baba, try to become a doctor. It's not easy to help willing children to pursue these kind of careers. But today, fortunately, we have substantial number of young boys and girls who are willing to be doctors, who are willing to take this challenge of taking up this profession. Therefore, we need to ramp up our availability of seats for medical studies, for the MBBS courses, for the post-graduation courses, for the nurses courses. So many nursing institutions were in the pipeline. In West Jaintia Hills, in Bakmara, you look at most difficult areas, so that parents will have their children in their own backyard going to nursing school and become nurses. What has happened to those? So we need to know our priority: health and education, the social sector. These are things which will obviously uh, determine, the status of our state. Human Development Index will position you whether you are at the bottom or at the top. So today, unfortunately, as a nation also, the Human Development Index, if you look at our Human Development Index, Bangladesh has gone ahead of us. Okay, Sri Lanka has gone ahead of us. So we are far, far behind as a nation. And even within the nation, we as a state, we are far behind. So therefore, there is no space to be complacent and just engage in rhetoric and do nothing. What we say must be demonstrated properly on the ground. And that is what is missing, unfortunately. I was just reviewing on the status in respect of East Jaintia Hills. The information available is that since we already have 100-bedded hospital in Khlam after the new district, we sanctioned that hospital. So you have the community health center. Every community health center is capable of having at least minimum 30 beds. It also has OT facilities. Okay. So when we are converting this maternity and child hospital into a COVID hospital, simultaneously all those existing infrastructure must be looked at. And they should be put to use. That's what I'm saying. Looking at the existing infrastructure and ramping all of them with the facilities required. Because our job is to ensure that we don't lose precious lives. We need to minimize. Maternity and child hospital is crucial because as a state also we have high maternal mortality rate. We have quite a high infant mortality rate. All these pull you down in your Human Development Index. And then the state is seen as a very backward with very poor health infrastructure facility, incapable of providing facility for pregnant women, for safe delivery, and even to save the newborn children. That's why all these facilities should be, when you are converting on maternity and child hospitals, what happens to the pregnant women? Where will they go? We have always encouraged mothers to come to the hospital and ensure that institutional delivery takes place. We have incentivized, we have a program to encourage these institutional deliveries. Now, therefore, even during this pandemic, that work has to go on. To save one life, you cannot lose another life. Every life is precious. That's why I'm saying no measure in isolation is enough unless it is, planned in a more comprehensive manner to save every precious life, which includes other non-COVID patients. Even during normal time, you see the hospital beds are not enough. That means you have people who require healthcare facilities, even during normal time. So similarly, now also, when we deal with the challenges of COVID, we also should look at the other aspects of our responsibility of saving lives. We had this particular issue deliberated upon, discussed upon number of times since the beginning of the pandemic, since last year. In fact, we have warned the government about the need to know where the enemy is. When you are fighting against the enemy, you should know where the enemy is, and testing is the only weapon to know where the enemy is. If somebody has contracted virus, unless we have a prompt testing measure, we will not know where the enemy is hiding. So in the process, we allow the virus to find another new host, and that another new host will also be facilitating, the virus after contracting the virus to find another host. That's what I'm saying. That's why no measures in isolation testing, tracking, treatment, prevention. Okay. When anybody who has contracted the virus has been identified and encouraged to have self-isolation and fight against the virus inside his body, once he recovers, that means virus is dead. That means your enemy is dead. He doesn't find any new host. That is how you can win this war against this virus. Unless we do that, virus will always find new hosts. Virus will still be around in our vicinity, and you will have the problem. So even as I say now, though we apprehend, though we should be prepared for third wave, if appropriate measures are taken, we can even avoid third wave. Yes, we can even avoid third wave. But we have to have the whole comprehensive measures put in place. And in the event of not being able to prevent, do we have the wherewithal to fight? That also have to be there. Thank you.
Finding with the government. Are you all party meeting or with the government?
No, we'll be talking. So it's a continuous process. We'll be talking. So everything need not be during the wartime. During the wartime, you don't follow all the formalities all the time. You have to pick up the phone and talk to them. Okay. So we'll be doing that. Not necessarily wait for another meeting. Another meeting is not to be decided by me. So therefore, we need to look at, we have already spoken on the site that this is what you should do. We will follow it up whether they do or not. See, one important thing is that the COVID-19 pandemic has been notified as a national disaster and is covered by the Disaster Management Act 2005. Therefore, all the authorities are equipped with the mandate of the law. Okay. The DC is the chairman of the District Disaster Management Authority, and the associated relevant sections of the Act empowers him. So when he sends a report to the concerned state level disaster management committee, of which the chief secretary is the chairman, the law makes it binding for them to respond.